So think about this. These numbers is you take a 12-hour shift, and out of that 12 hours, we're saying is about 3 to 4 hours is all that you need a bedside nurse for, or that is the amount of time they're actually dedicating to activities that only they could do. That was an absolute light bulb moment. Forget how you deliver nurse care today. Tell us how you would, in a utopia, be able to deliver the care.
Welcome to the Lay of the Land podcast, where we are exploring what people are building in Cleveland and throughout Northeast Ohio. I am your host, Jeffrey Stern, and today I had the pleasure of speaking with Akram Boutros, co-founder and CEO of Nexus Bedside. Akram brings more than 30 years of experience as a healthcare leader, executive, and clinician. He previously served as CEO of the MetroHealth system here in Cleveland from 2013 to 2022, where he led a team of more than 6,000 employees and 3,500 medical staff, overseeing a nearly $1 billion revenue operation and complete transformation of the MetroHealth campus and care model. Prior to that, Akram held senior leadership roles at multiple health systems across the country, and he began his career as a physician, earning his Doctor of Medicine from SUNY Downstate Health Sciences. Akram is also a serial entrepreneur, and in 2025, he raised a few $1 million of seed capital to found Nexus Bedside, a company reimagining inpatient nursing staffing, working to fundamentally improve outcomes for patients, nurses, and health systems overall. In this conversation, Akram and I unpack his full journey and perspective on healthcare and entrepreneurship, from immigrating to the U.S. and becoming a physician to his decade-leading MetroHealth, to navigating a public and controversial departure from the public health system, and ultimately experiencing the healthcare system as a patient himself. We explore how these experiences shaped his decision to start and build Nexus Bedside, his philosophy on leadership, lessons learned as an entrepreneur, and the massive opportunity for AI in healthcare, and what he believes the future of inpatient care and nursing should be. So with that, please enjoy this awesome conversation with Akram Boutros. Lay of the Land is brought to you and is proudly sponsored by Cerity Partners. As a wealth management firm, Cerity Partners shares Lay of the Land's same dedication to serving local business owners, and the Cerity Partners Cleveland team understands the challenges that entrepreneurs and founders face here in Cleveland, Northeast Ohio, and beyond. Wealth comes with complexity and increased demands on time and resources. It is easy to become overwhelmed. Cerity Partners clients benefit from a unified team of local specialists who coordinate across both business and personal needs. With Cerity Partners' commitment to transparency and putting clients' needs first, complexity can become clarity. To learn more, please visit CerityPartners.com or call 216-464-6266 today. Cerity Partners, proud to be recognized as one of the top financial advisory firms in the country. So Akram, I know you've been through a pretty remarkable journey, I think professionally from clinician to leading a large public health system here in Cleveland to navigating, the public conclusion of that chapter and, re-entering an experience both as a patient and now as a founder yourself. And if you zoom out kind of across the entire arc of that, I'm curious what you feel and see as the through lines and what connects that professional journey that you've been on and what underlying you're working towards.
So, I would literally have to go back to being 15 years old and experiencing trauma. So I was hit by a moving truck when I was 15 years old and spent time in the hospital. That was really a pivotal moment in my life in which I decided that since I couldn't really figure out what's coming next or how long I'm going to live, it's best to make the most of it and just to try to make progress each and every day, be a better person, do more, be more helpful and more effective. So I think the ups and downs of my career, there have been incredible highs and terrible lows, excuse me, that there isn't, they don't matter as much as looking forward and not living in the past, right? So I always say to my my case, the only time you look in the rear view mirror if you want to go backwards. So that's not something I want to do for any reason whatsoever. So I constantly look forward. From my point of view, it's you're dealt a set of cards, and you got to figure out how to play them and just keep moving forward.
Well, if you would indulge a retrospective look for a moment and some of the cards you were dealt, I know beyond that, I mean, real tragic bus incident, you also had immigrated to the U.S. when you were a kid. And I'm just curious, what that was like. And when you look back, from where you are now, despite maybe you're not wanting to do that as much, what do you feel were some of those most formative, moments and experiences and lessons from your upbringing that you feel have shaped who you are today and how you operate?
So so I'm the youngest of three boys. We all came here. I was 12 and a half. My middle brother was 15, and my oldest brother was 17. And we left Egypt, and I certainly didn't speak a word of English. My parents were both educators at certain points in their lives, so they took education, and our school is the most important thing. So my brother and I weren't permitted to do anything except excel. My mom drove us pretty hard with my dad instilled in us in a work ethic that was uncompromising. So it was a very, very difficult time, and not a lot of folks who were from the Middle East at the time when I came in 1974. And so I learned to overcome obstacles. And as I said, my mom, there were no excuses either for my mom or my dad. You just had to get it done. And so I learned a great deal to analyze problems and try to overcome them. I went to the most uh, violent school in New York City for 10 years in a row. We had murders inside the school. We had a lot of a lot of fighting going on in the school. And so you also learn to get along with a lot of people if you wanted to get out of there alive. So we college was pretty good. Met the most important person in my life, and that's my wife at the age of 18. Went through the journey of being together, went to med school, got married while I was in med school. I went to academic medicine to do business. I've always had businesses, even at the age of 15. I started a business at 17 and was asked to go into the business side of healthcare, and that started my journey.
What drew you to medicine in the first place?
So I always liked sciences. I will tell you that it probably was my mother's cousin who in Egypt was just a terrific human being. He was such a wonderful person. And as a young person, I equated his profession with who he is. That if I wanted to be as nice as and good of a person as he was, I would go into medicine. So he would have been amazing in any profession. I just didn't realize that it just because he was a wonderful human being, not that he was in medicine. So that's what really drew me to it. And then the idea of being trusted at the most vulnerable times in people's lives, and I consider that an honor, and I still do, to be able to impact people when they're in most in need.
And you mentioned you had also this kind of entrepreneurial inclination since you were pretty young as well.
Yeah, well, my dad was always in the business world, and there was no risk taking, especially in the business side, was something to be managed. It wasn't something to be avoided. So I told you when I was hit by the truck. I was hit while I was delivering papers, and I had this great paper route, and except I ended in the hospital with both my legs broken, and couldn't deliver papers. So the manager of the paper routes called me and said, "Well, we're going to give you a paper right away." I said, "Hell no! I have a great paper route. I've great customers. I'm going to have someone deliver it for me." And I called a few of my friends and said, "I'll take 20% of the tips. You guys get the rest of it. Let me tell you everything about everybody and how to do well." And that was my first foray into business.
Yeah. So I want to set a good stage here for the work you're doing with Nexus today. And I thought an interesting way to do that would be to explore the experience you've had really at every level of healthcare as a clinician, as a CEO, as a patient, as an entrepreneur. And just from your purview and perspective that you have, which I think is pretty unique as far as healthcare entrepreneurs go, just what you came to understand about how healthcare works and where it works well and where it doesn't work, and how that's kind of shaped your strategy in an approach to building something within this world.
Sure. So there's the, think of it this way. I have the perspective of being frontline staff, where I took care of patients and alongside nurses, technicians, other folks in the healthcare field. I've also had the opportunity to manage people who deliver care. So did that in running departments and all of these types of activities. How to have the perspective of setting direction, analyzing problems, and seeing if we can develop solutions through the strategy lens. And I did strategy for many years. Then had to figure out how to keep all the trains running on time and not colliding with each other, which is my operating background as chief operating officer. And but then finally, as CEO, which is having a 50,000 foot view on understanding that there are lots of fires going on in hospitals today. And my job is not to actually put out the fires. My job is to build the fire suppression system. All of those things, all of those roles were done from an experience from an episodic interaction with the staff and patients and other personnel, and always done from the vertical position where I was standing. Right when I was diagnosed with non-Hodgkin's lymphoma, I ended up having this continuous interaction with the healthcare system that spanned weeks and overall 2 months of continuous care from a healthcare system. And this one was experienced from a horizontal position. And I would just tell you, it gives you a very, very different perspective. I'm not sure the entrepreneur side uh, makes much of a difference. I think these two aspects and what I've ended up experiencing is really what shapes my view of healthcare and what needs to happen to improve it.
What do you wish more people understood about what it takes to run a health system?
Well, there are things that I think people don't realize, and I think there are things that we whine about too much as healthcare executives. So I don't think people realize that it is incredibly complex. The rules of engagement, whether they're regulatory, financial, operations, quality, personnel management, they interact like no other industry today. You can tell when with great flair, Google, JP Morgan, and Berkshire Hathaway came together about 8 or 9 years ago and said they're going to reform healthcare. And 3 years later, they gave up and never created anything. It tells you how very capable people end up getting stymied with the amount of contradictory rules and nonsensical and non-value added issues that are out there. So people don't understand how complex it is. But on the other hand, is that the inertia. I can tell
Hmm.
you is the vast majority of people who are in healthcare today complain about the status quo, but will do almost nothing about this as well. So they need a burning platform to really make these leaps of improvements, and they have to be almost forced into it.
So when you think about your time at Metro and really this billion-dollar transformation of the system, the culture, the capital plan, the expansion, what what were the bets that you were making, in light of the way that it works that you came to understand, and what was your kind of vision for how to ameliorate a system like that?
So there were three things when I was interviewing that I noticed. I noticed that uh, uh, three problems that I noticed. I noticed many wonderful things. I noticed a staff that was absolutely committed to taking care of patients, people who could have gone and worked for university hospitals like Cleveland Clinic, but chose to work at MetroHealth to serve the underserved. There are so many positive things. Their heart being the most important and really most extraordinary thing I've noticed. The three things that I noticed was that first is that we treated patients because as if we were the hospital of last resort. So that meant is that you get what you get. We expect the patients to get what they get and not get upset. And I said that's absolutely the wrong way to do this. We should want patients to choose us, not that they don't have any other choice. We want everyone, those who have a choice and those who don't have a choice, to want to come to mental health. So that was the first thing I needed to do. The second thing is I noticed that everybody was willing to step in and help solve a problem, except we were like a centipede with every leg is going in a different direction. So a lot of frenetic energy, but not a lot of forward momentum. So we needed to create, and literally during my first 6 weeks, create a new mission, vision, and values for the organization to align us. And it's still the same mission, vision, and values that we created 13 years ago. So that was a second thing. And then the third thing was that I had to tell the frontline staff and the providers was their job was to take care of people. Their job was not worry about how we get paid, where we get paid, all of those different things. That was administration responsibilities. So I didn't I wanted them to focus on what they know best and let us focus on what we know best. And that's why MetroHealth, the 10 years before I got there, they averaged about $6 million profit or $60 million across those 10 years before I got there. And in the 10 years of my tenure, instead of 60 million, we ended up having 600 million profit.
What's the best case scenario for a health system? Like, how do you think about what, as far as like how good a health system could be? What does that look like? Like, what was your North Star?
So there are four quadrants that I think about. So I think about outcomes, quality, safety, and honestly, safety is the bare minimum, right? You want to go to a hospital and you want to not get hurt, and we have way too many patients who get hurt in hospitals. So safety is and the quality of care is absolutely the most important of all the things. You have to perform well in the while you are also having satisfied patients and providers. So I look at that from the service side, having a committed staff that wants to stay and wants to be and is happy there, and patients who want to come back and utilize the health system. The other one is operations, which is making sure things are efficient so that when we don't have a lot of these non-value added steps. I remember one process I did years ago. There were 40 3 different steps that needed to happen for a patient to get to the operating room, and we reduced them to 14. So that's a lot of wasted energy when you have 43 that you can reduce to 14. And then financial strength. You need to be able to be profitable, whether you're a not-for-profit hospital or not, because you need to reinvest in care. So these are the 4 quadrants. Is there anybody who does them incredibly well? There are. There are organizations that I think have beaten the odds. In New York, NYU Langone health system does an amazing job. Northwell does incredible work. Intermountain. So there are some extraordinary health systems. All of them still have challenges, and all of them still have really monumental opportunities to improve.
Lay of the Land is brought to you and is proudly sponsored by Roundstone Insurance. Headquartered in Rocky River, Ohio, Roundstone shares Lay of the Land's same passion for bold ideas and lasting impact from our community's entrepreneurs, innovators, and leaders. Since 2005, Roundstone has pioneered a self-funded captive health insurance model that delivers robust savings for small and medium-sized businesses. They are part of the solution to rising healthcare costs, helping employers offer affordable, high-quality care while driving job creation and economic growth throughout Northeast Ohio. Like many of the voices featured on Lay of the Land, including Roundstone's founder and CEO Mike Schroeder, Roundstone believes entrepreneurship, innovation, and community to be the cornerstones of progress. To learn more about how Roundstone is transforming employee health benefits by empowering employers to save thousands in per employee per year healthcare costs, please visit roundstoneinsurance.com. Roundstone Insurance, built for entrepreneurs, backed by innovation, committed to Cleveland. So, making our way towards Nexus here, your departure from Metro was sudden. It was public. What does that period teach you in reflection about governance and trust and just those kinds of processes?
I expected governance to perform the way I expected my staff and myself to perform. We were always prepared. We always documented our decisions. We always remembered them. And we were very open about what we were doing and how we were doing it. As a matter of fact, the board would tell me that I often shared too much and explained too much. And I just don't think that's the case. If an employee in a town hall asked me a difficult question, they got an answer. It was the truth. So I expected that from the board. It turned out there are some folks who don't remember things. They don't record them as well as they should have. And especially in meetings when I was not in there. So, for example, most boards, when they discuss compensation for executives, they recuse that executive and rely on consultants to go through the information. But also most boards would tend to provide a summary of the outcomes to the executive, not the discussion itself, but look, here's what we examined, and here's the conclusion we've made. I never received any of those things, so I couldn't tell them that for example, that they weren't looking at actual numbers; they were looking at hypothetical numbers. Well, when they found out that they've been doing that, that's a very embarrassing moment for people, and the way they ended up trying to rectify what I would say is lack of governance on their part. And the auditor said there was a problem with governance. The Higher Ethics Commission said I didn't violate any ethics laws or anything else. The county prosecutor said there were nothing criminal in anything that I did. And the auditor said my contract was ambiguous, so everything that I had done was according to the contract. My interpretation was fine. And also all the resolutions were the board approved. So what it taught me is that you can't just assume that other people are working to the same level that you expect of yourself and your staff, that you have to make sure. You have to make sure that that's happening. And you can't just assume that just because they're going into hours and hours of discussion with a consultant that they have all the information, just because the consultant's contract says that they will provide the compensation committee or the board with your actual remuneration, that's happened, right? So these are the things I assume because I read the contracts and that's what it is. And that turned out to be not true. So for me, what I learned, I will tell you, is that who the most I learned from this entire thing is that I may have had 2,500, 800 contacts in my contact list who I considered to be friends and colleagues. That number dwindles very quickly to about 200 when something like this happens. And I so appreciate now committing my energy and love and care to these 200 rather than the 2,800.
So with the time and space to reflect, perhaps, additional perspective, you mentioned the horizontal one. How did you decide what to work on next? Again, I imagine from the perspective that you had, both as a clinician and as a leader of a large healthcare organization, just a really deep understanding of not only where the system is structurally strained, but structurally broken, and just of all the things you could have focused on, what is it about Nexus that got you inspired enough to focus your time and energy on this specifically, and maybe just help introduce what Nexus Bedside is?
Sure. So when I was leaving MetroHealth and I had announced my retirement in 21 that I was going to leave at December 31st of 22, I looked at what are the where are the areas where I could make a lasting impact, where I could um, help change things. And we had just come through COVID and the nursing crisis. Any way I sliced it, diced it, looked at solutions, we were going to, nurses were leaving the bedside at such a rapid rate, and people were getting older at such a rapid rate that we are going, if the crisis is bad now, it's going to be disastrous in the next 10 years. So I said, well, having experienced inpatient nursing and inpatient care, there's no alternative. When you need a hospital, you need a hospital. You don't have a choice. You can't have somebody who's hit by a truck or somebody that needs cardiac surgery say, okay, I'm going to hold off. That was a very, I saw that as an area that needed a resolution. I also saw that we, the frontline staff, have become slaves to the electronic medical record. That they spend more time on that than other things. So that was a very large issue that I looked at. And then the last one was that there was a significant opportunity to provide more teamwork, especially on the inpatient side, that we were all acting like ships that passed in the night. So when I left, began thinking about that, and in February 23, came up with a hybrid nursing model that uses virtual nursing and bedside nursing. The same team that switches roles on a regular basis to be able to deliver more efficient and better care. And so I began looking at the technology to do that, and began looking at studies and how to create a new business, how do you fund it, all of those different things. By September of 23, I was diagnosed with non-Hodgkin's lymphoma and required inpatient stays, 1 week about every month in the hospital. And that's when I got the horizontal perspective, and I became absolutely appalled at what nurses had to do to get through a shift, and began to seriously understand why 60% of new nurses leave the bedside within 2 years. So I looked at nurses get interrupted, med-surg nurses get interrupted about 10 times, and that's unsustainable. 20% of the work that they do is completely non-value. Another 20% can be done by a non-professional, non-nurse. And of the remaining 60%, half of it has to be done, it could be done by a virtual nurse, a nurse that's not on site, that is not providing hands-on care, and 30% has to be done by a nurse that's providing hands-on care. So think about this. These numbers is you take a 12-hour shift, and out of that 12 hours, we're saying is about 3 to 4 hours is all that you need a bedside nurse for, or that is the amount of time they're actually dedicating to activities that only they could do. That was an absolute light bulb moment, and it created. We began very quickly to look at new workflows. That we started with nurses and asked them, forget how you deliver nurse care today. Tell us how you would, in a utopia, be able to deliver the care. And I had a lot of experience with that in the early 90s. There was a company called Milliman, which still exists. It's a major actuarial company. And they said, we want to create something called optimal recovery guidelines. And the optimal recovery guidelines is that if you had all the resources in the world and everything went spectacularly well, smooth, how long would it take to treat a patient with pneumonia? How long would it take to treat a patient who needed open heart surgery? And we had this fantasy that we created of these things that ended up becoming the optimal recovery guidelines. Well, I did the same thing with nursing, and we created these workflows that ended up taking away 60 to 80% of the documentation, electronic medical record documentation from the bedside nurse, permitting a bedside nurse, even if they have more patients than they had before, to spend twice as much time with every patient, face-to-face hands-on care, than they did before the change. Eliminate errors in medication delivery, eliminate falls and inpatients with falls with injury, and improve the happiness of both the patients and the nursing staff. So we designed this thing, and then we went to Ochsner Healthcare to test it, and their simulation lab, and the results were absolutely spectacular. And since going live in July, our results have really surpassed every other company in this space.
So what does this look like in practice, and what are those results yield in reality?
So what we do is we go on a unit and watch exactly how they deliver care. We document the workflows and then work with them to eliminate the time wasted things, and then break up the entire workflow between virtual and bedside nurses. And we utilize artificial intelligence to consistently improve and constantly improve workflows. And so if you're a patient and you get admitted to the hybrid unit, the bedside nurse comes in, greets you, gets the virtual nurse on TV, tells you that they are a member of the team, explains to you that they may be your virtual nurse today, and then tomorrow they're going to be your bedside nurse, and vice versa. And the virtual nurse now can, and that takes about 2 minutes, by the way. And the virtual nurse now can do the admission. The vast majority of the admission, they do about 80% of the admission, and documentation and everything else in the medical record, and leave only the physical exam for the bedside. And once they're complete, they answer all these questions, do everything else. The bedside nurse comes back and finishes the admission. And every time a nurse needs to check on you, or you need to talk to a nurse, all you have to do is say, hey, Nexus, get nurse. and they will pop up. We utilize cameras and very high definition cameras and AI to understand what's going on in the room and be able to take care of patients. We can monitor patients' vitals as we utilize our cameras to be able to do that. We can even diagnose a patient we've diagnosed patients who are having a stroke using the ETZ camera. We've diagnosed patients who are having a seizure. We've also eliminated a lot of falls and been able to do a lot of these different things. We answer questions for patients and families when the doctors and the nurses aren't available. The virtual nurses do that. And we monitor the patient on a regular basis. So typically, bedside nurses are supposed to do go see every patient every 2 hours, at least once. Okay. Well, they're passing medications, they're answering phones, they're writing in the medical record, all of that. In a typical hospital, you see a compliance rate between 35 and 45%. With our model, 93% compliance rate with hourly rounding, and that helps patients get better quicker because we're constantly taking care of them and responding to their needs, and it lowers length of stay.
What is the business model?
We get paid for our technology and our workflows, and we also, I think we're the only company that has a nurse executive who actually stays with the organization that we pay for, a client success partner that is working with the staff every day to make sure they're optimizing the process. So we get paid per patient per day amount. And then because we are so confident in our results, we guarantee certain results and we get paid on improvements. These could be everything from payroll reduction per discharge to length of stay reduction to patient satisfaction improvements to reductions in vacancies, reduction in turnover, a lot of different things, quality measures, all these different things. So we have a base amount that we get paid, and then we get paid on results.
So you mentioned this deep-rooted inertia, kind of structurally embedded in the system, and also your eye towards, the future and what comes next. And when you take everything that you're working towards and you imagine this version of the company that fulfills the reason that you founded it in the first place, like what does that world look like? What is the ideal state? How do you know you have gotten it right at that point? And what is how do you think about what success means for Nexus?
So success means we will have enough market share to have changed how the industry works, so that this hybrid model gets adopted. And by the way, we are very happy to have other companies copy us and provide the same type of services. We can't take care of everybody. We cannot provide these services everywhere. We just want to be the best. We don't want to be the most utilized, right? So it's not about how many units we're selling and how many people we're taking care of. We want to be constantly at the tip of the spear. We want to be able to provide that through, imagine never having to wait in an emergency room. Imagine that we are working on a product right now that as soon as you walk into the emergency room, you are triaged by our AI, and her name is Amy. She has artificial intelligence for monitoring education and engagement, and a virtual nurse and a bedside nurse. You have literally zero wait time, okay? And we have enough information to be able to manage the care. We're working now on a really crazy idea that for people to be able to live and age at home. So a couple who are in their 80s and someone gets sick that is going to needs care, we actually are integrating with robotics to be able to help that robot clean the house, put away the groceries, help lift the patient, get them to the bathroom, And utilizing the computer vision of the robot, we can actually provide virtual nursing care. We are now thinking about AI, and this is the frontier here. AI is going to be entering the physical world, where AI will actually be able to do things for you. So I think within the next 3 years, we'll be able to deploy that, and we will be deploying Amy in hospitals early next year.
So you've integrated AI into the workflow for all this inpatient care. When you think about AI in healthcare today, I mean, where do you believe it creates real leverage? Where do you see it's limited? In other words, like what today can it actually solve, and what, if anything, needs to remain, fundamentally human in healthcare?
So the reason we're called Nexus is that we're at the nexus of technology and compassion. So compassion cannot be delivered by AI. The ability to AI can do three things. It can be always present. So it can be an extension of you. It can help garner information that you cannot garner because you can't be at 10 places at the same time. So that's one thing. It does not have compassion fatigue. So it can actually gain more information than you could ever spend with anybody on these things. And it can put it in a way, it can group it in a way that it utilizes the latest research to help you see the problem a lot quicker. So the cognitive overload of being a clinician, the amount of strain, it can actually help reduce that. So these are the three things that I think AI can do today. What it cannot do today is take care of patients. What it can't do today is um, do things that are incredibly human. It cannot hold your hand and make you feel better. Well, one day be able to start your IV, and that's when AI enters into the physical world? Absolutely. Will it be able to do your scan and interpret the scan? Absolutely. Um, do I want anybody to go through? I mean, look at even Star Trek, right? They used tricorders, they did all of those things. There were doctors and nurses. That will not change. It just extends their capabilities.
What's been most surprising to you in this journey so far as an entrepreneur in the industry rather than as an administrator or a practitioner?
So I've always started businesses either for the hospitals that I worked for or for the companies. I started, I think, when I was very young, the most successful gamma knife startup in the country. That's one of my small hospitals. The lessons I learned here is that if you're an entrepreneur, you have to fail effectively, and what that means is you fail small, you fail fast, and you fail forward. You're constantly learning, constantly iterating. And that is why our technology partner makes sure that we iterate every 4 weeks. So that's important. What I've learned is that the wisdom of people who have done these things, they create a framework that really does not challenge the status quo and works on incrementalism. Everybody told me it's going to take us 2.5 years to get to our first customer, 2 years to sign a contract, 6 months for us to go live, and then it's going to take us another year and a half. So 4 years total for us to get recognized in the business. We finished our raise in February of 2025. We signed our first contract in April of 25. We went live in July of 25. We are a pipeline of folks that we are looking to roll out in the fourth and quarter and first of this year and first quarter of next year. So we challenged the status quo, and we just said, and we've actually had to turn hospitals down who said we want to work either piecemeal or slow in this, and you cannot deliver transformation by working at it.
How do you get health systems to move faster?
I think you just present them the opportunities, and those who are either innovative enough or understand the system well enough will move faster, or those who are desperate enough will need to move faster. These are the two clients that we're seeing that are very receptive.
What do you feel have been the biggest challenges of Nexus so far?
Really finding these individuals who are not afraid of the transformation. I cannot tell you how many people you talk to who you can demonstrate to them a better outcome, and they just say, "Well, what's going to happen here?" and think of the worst case scenarios. And I end up telling them the worst case scenario is what you have. That is the worst case scenario. And there for me the worst decision is no decision.
Are you optimistic about the situation for nurses writ large?
Yes, very much so. I believe there's enough attention right now, and there are enough um, technology and focus that we will see a faster adoption. When I began thinking about this in 23, less than 15% of the chief nurse executives knew about virtual nursing or had been contemplating to start a pilot. Today, it's expected that by the end of this year, 80% of chief nurse executives will have at least designed a pilot, if not impacted role.
Hmm.
That's
And the
incredible adoption. That is not what you normally see in healthcare, especially on the inpatient side.
Yeah, and the reception is generally well received.
Yeah. So today, if you're a chief nurse executive and you're not looking at virtual nursing, you are behind the time. You are a laggard. You are not an innovator. You're not even early adopter. You're not in the and you are a laggard. You are in the last 10-20% of people who don't know that that train is coming.
So you've chosen to build Nexus here in Cleveland, and I'm curious as to the geographic decision. As someone like yourself who's also not from here originally.
Yeah. So we live here. This is our home. My daughters live here. We have a home in Florida. We actually have a, a, a location in Florida that we do our back office from. So it doesn't matter. I wanted a team around me that I could see each and every day. Most of our core team, all of our core team, works actually from the office here every day. I don't think I just while care or virtual technologies have improved a lot. That's why we use a hybrid model, or the nurses that move from virtual to bedside and from bedside to virtual, because teamwork requires a single team that sees each other on a regular basis and works together towards the same goals. So that's what we do, and that's what I believe in.
What else have you learned from about leadership that feels particularly salient that you've channeled into the culture of Nexus?
Like I would say, tell you the lessons is killing effectively, like I talked about. Also, we don't have a culture of blame here. Things happen, and our job is to make relentless forward progress. It doesn't matter what happened yesterday, and never listen to people who say you can't do something. That is absolutely a reason for you to examine it and make a decision yourself. I'm not telling you they sometimes can't be right, but I will tell you there are many where
Mm. I'll ask a kind of a greenfield question, which is when you reflect on this whole journey, is there something that feels particularly important as part of it that we haven't talked about yet that you would like to?
there was a movie that talked about a doctor who became a patient and then required all their residents and other staff to become patients. I wish, without people having to get sick, that they could spend 24, 48 hours, 72 hours in a simulation, and that we do that as a part of everybody becoming a physical therapist and a nurse, a doctor, anybody who's providing care, and do that. I remember when I was in Leadership Cleveland, we did a poverty simulation, and that truly impacted me because when we came from Asia to Queens, New York, we did not have a lot of money. We weren't poor. We all ended up working, even and myself as a young person ended up working. So we were all had the opportunities to collect the money and be able to live and not have housing and all of those things. Not great housing, but it was what it is. But felt state. When I did the poverty simulation, it felt uh, out of control, and I learned a lot about poverty, and it also led me to the creation of the Institute for Hope at MetroHealth. So I would want to find a way for people to spend 1 to 3 days in a simulated environment with inpatients to understand what it's like and be able to manage the insurance and everything else. So the system is so complex, and we end up focusing on our own piece of it. And I wish people would have broader knowledge of what it takes.
Yeah. Do you think empathy can be taught at scale? Because
Absolutely.
yeah,
The Cleveland Clinic actually showed that they were the first people to teach empathy at scale, and they did a great job with it.
yeah. I know. I think that would be a pretty powerful experience for folks who, unless you do experience it, it is hard to understand, what it entails.
And empathy isn't how you think; it's empathy is how you act. People think that. I mean, here's a thing that I could tell you that we didn't talk about. People believe that you change the way you act by changing the way you think. That is absolutely backwards. You change the way you think by changing the way you act. So you have to take action first, and that action will change the way.
Yeah, I could see that. Experience shaping your mental model.
Yep.
Hmm. I like that. Amazing. Well, Akram, I just want to thank you very much for taking the time, sharing a little bit about your story, and reflecting on the journey. I know your proclivity is to look forward, but I appreciate you taking the time to look backwards a little bit.
Oh, you have to examine it. You just can't dwell on it and wish it didn't or it could have done a different way. You have to reflect on what just happened. But once the lesson is learned, let's just move on, right? You can't live in the past. You can't. I see it as re-victimizing myself, right? I don't want to become a victim of other people. I want to be able to take control. So, Jeff, thank you very much for having me. It was wonderful speaking with you.
No, thank you. I'll ask one more traditional closing question, which is for a hidden gem in Cleveland.
Oh, there are so many hidden out. But I will tell you this. Every every now and then, I want to get New York style Chinese food, and New York style Chinese food, the closest I get is Hoa. So that is where I go when I want New York style Chinese food.
Perfect. I love it. Well, if folks had anything they wanted to follow up with you about, learn more about Nexus, where would you point them?
It's A Boutros at Nexus.
Awesome. Well, thank you again. Really appreciate it.
Have a great day.
That's all for this week. Thank you for listening. We'd love to hear your thoughts on today's show. So if you have any feedback, please send over an email to jeffrey@layoftheland.fm or find us on Twitter @podlayoftheland or @sternhefe, JEFE. If you or someone you know would make a good guest for our show, please reach out as well and let us know.
And if you enjoy the podcast, please subscribe and leave a review on iTunes or on your preferred podcast player. Your support goes a long way to help us spread the word and continue to bring the Cleveland founders and builders we love having on the show. We'll be back here next week at the same time to map more of the land. The Lay of the Land podcast was developed in collaboration with the Up Company LLC. At the time of this recording, unless otherwise indicated, we do not own equity or other financial interests in the company which appear on this show. All opinions expressed by podcast participants are solely their own and do not reflect the opinions of any entity which employs us. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions. Thank you for listening, and we'll talk to you next week.